Have you ever stopped to wonder what's really going through your doctor's mind the moment you walk into their office? It's not exactly a comforting thought. Most of us prefer to believe that every word they speak is unbiased, purely professional, and free of hidden judgments. But the truth is, beneath the warm smiles and polite nods, some doctors carry quiet, unspoken beliefs about older patients, beliefs that can subtly shape the care you receive. These ideas aren't always flattering. In fact, they're rarely spoken out loud. Yet they can influence whether your symptoms are taken seriously, how thoroughly your treatment is planned, and even which medical options you're told about. In today's video, we're pulling back the curtain on 5 surprising truths about what many doctors actually think about older adults. And once you know them, you'll be far better prepared to make sure you get the attention, respect, and care you deserve every single time you step into a medical setting. Stay with me until the very end, because truth number 5 may completely change how you approach your next appointment. Number 1, they often assume your symptoms are just part of getting older. One of the most frustrating realities many seniors face is that some doctors automatically link their symptoms to the aging process. You might walk in complaining about back stiffness, constant fatigue, or occasional lapses in memory, and instead of a deep investigation, you hear something like, "Well, that's just normal at your age." While it's true that aging brings changes, this mindset can lead to misdiagnoses and delays in treating conditions that are entirely real and often very treatable. The danger is simple. Once a doctor decides something is just old age, the urgency to dig deeper often fades. That breathlessness you feel might be dismissed as a normal slowdown, when in reality, it could be an early sign of lung disease. That forgetfulness might be brushed off as a harmless senior moment, when it could be caused by a medication interaction or a thyroid imbalance, both of which can be fixed. I once met Harold, a 79-year-old who had been feeling unusually lightheaded and tired. His doctor told him to rest more and not worry. It's just age catching up. But months later, after Harold pushed for further tests, it turned out he had severe anemia from an undiagnosed ulcer. Once treated, his energy returned, and he often said, "I wish they had looked closer the first time." This kind of oversight doesn't always come from carelessness. Sometimes it's the pressure of short appointment slots and a long line of patients. Familiar complaints from older adults can make it tempting for doctors to jump to the easiest explanation. But easy doesn't always mean accurate. Depression, vitamin deficiencies, and even early cancers have all been overlooked because of this habit. The takeaway? Age should never be the final answer to why you're unwell. Your health deserves the same thorough investigation as anyone else's, no matter your birth year. Number 2, they may assume you won't follow through on a treatment plan. Here's another bias that often lurks quietly in the background. Some doctors believe older patients either can't or won't stick to medical instructions as well as younger ones. This assumption can cause them to oversimplify your treatment or leave out more advanced options. While it may be intended to make your life easier, the result is often that you receive a less complete plan than you deserve. Sometimes this belief stems from stereotypes about memory issues, hearing difficulties, or the complexity of managing multiple medications. A doctor might think, if I explain too much, they'll forget, or this therapy is too complicated for them to manage. But these assumptions simply don't hold true for everyone. Many people in their 70s, 80s, and beyond are highly disciplined, tech-savvy, and proactive about their health, often more so than patients decades younger. Take Marion, who at 82 was diagnosed with heart rhythm issues. Her first cardiologist offered a bare-bones plan, thinking she prefers something simple. But Marion wanted to understand every option, so she found another doctor who explained medication combinations, dietary strategies, and tailored exercises. By following the full plan, she regained her energy and stayed out of the hospital for years. The lesson? Show your doctor you're committed. Bring a notebook to appointments, ask for written instructions, and follow up with questions. When they see you're engaged and capable, they're far more likely to share every possible treatment path with you. Because in truth, adherence to treatment has far less to do with age and far more to do with clear communication and genuine motivation. Number 3, they may unconsciously prioritize younger patients. It's an uncomfortable reality, but in situations where time, energy, or resources are stretched thin, some doctors instinctively give more attention to younger patients. The reasoning? Younger patients are often seen as having more years ahead, so the return on medical effort is viewed as greater. But this perspective ignores something vital: the value of improving quality of life at any age. A 40-year-old deserves to live pain-free. Yes, but so does someone at 75 or 85. And the benefits of the right treatment can be just as life-changing. I once spoke with Eugene, a 78-year-old who had severe shoulder pain. His first orthopedic specialist said surgery was too much for his age and suggested painkillers instead. Eugene, still an avid fisherman, wasn't ready to give up his active life. He found a surgeon who assessed him as a person, not a number, and went ahead with the operation. Months later, he was casting lines at sunrise again. If you feel like your care is being deprioritized because of your age, speak up. Ask directly about all available options, and, if necessary, seek another opinion. Age should be a factor in your care, but it should never be the deciding factor. Number 4, they may underestimate your personal goals. Some doctors quietly assume that by the time you reach your later years, your ambitions shrink to just staying comfortable. But for many older adults, that couldn't be further from the truth. You might want to travel, start a new hobby, or chase a dream you've held for decades, and your medical care should support that. Consider Lydia, age 81, who dreamed of attending her grandson's wedding abroad. Her lung condition made travel difficult, and her first doctor told her to focus on staying cozy at home. But when she found another physician who listened to her goal, they built a plan: pulmonary rehab, updated meds, and careful trip preparation. 6 months later, she was dancing at the wedding. Your ambitions matter. Whether it's hiking a favorite trail, volunteering, or visiting family far away, tell your doctor what you want for your life, not just your health. When they see you as a whole person with a vision, they can help you live not just longer, but better. Number 5, they may overlook the emotional weight of aging. Many doctors focus almost entirely on the physical body, blood pressure, test results, and visible symptoms, while the emotional side of health gets pushed aside. Yet aging is as much an emotional journey as it is a physical one. There's adapting to loss, shifting identities, and sometimes grappling with reduced independence. These emotional realities can directly affect physical health, impacting sleep, immunity, appetite, and recovery. I think of Frank, who lost his partner after 50 years together. Soon after, his health began to decline, but every doctor visit was about adjusting his prescriptions. No one asked how he was really doing. Only when a friend suggested counseling did Frank start feeling like himself again. His physical health improved, too. Not because his meds changed, but because the emotional weight began to lift. If you're feeling lonely, anxious, or weighed down, tell your doctor. Emotional struggles aren't just part of aging. They're real health concerns that deserve attention. A good doctor treats the whole person: body, mind, and spirit. Sometimes the most powerful medicine starts with a simple conversation. These truths may be difficult to hear. Some of you will recognize them from personal experience, while others might feel shocked or disappointed. But knowing them puts the power back in your hands. Your age doesn't make your health less important. Your story, your resilience, and your goals matter just as much now as they did decades ago. If you ever feel dismissed or overlooked, don't see it as a dead end. See it as a sign to speak louder, ask more questions, or find a doctor who truly sees you. The best healthcare happens when patient and doctor work as partners. That means bringing your full self into the room, your questions, your goals, and your voice. Carry this knowledge with you. Let it shape your appointments, guide your decisions, and remind you that your well-being is worth fighting for at every age. If you found this video helpful, let us know in the comments one thing you're taking away and how you'll use in your life. Your stories inspire us and help others too. And if you haven't already, like, subscribe, and share so we can keep creating content that empowers you. Thank you for watching. And remember, your life matters, your goals matter, and your health deserves the very best care.